Hi, I'm Aaron Zolbrod, president and founder of the Health Insurance Store. This is part 3 of my Medicare Reset Series. What are my options in Medicare plans and how do they differ? So your 3 options in Medicare plans, the first option is not really a plan, so to speak. It would be just to go with Medicare A and B. Your other option would be a supplement, aka Medigap, which is a great name we're going to talk about here in a moment. And another option is Advantage plans, which are also known as Part C. And if you're just tuning in from watching Part 2 of the Medicare Reset Series, we discuss what Part C is. I'm not going to get into that. I don't want to confuse anybody more than people already are. But go back and watch the Part 2 and you can get the definition of that. Only 2 of the 3 are viable. Medicare has no limits on what you can be billed in a calendar year or in a lifetime for that matter. You could be billed for everything. So I'm going to give you the example. James Conner, Pittsburgh Steelers running back, when he was at the University of Pittsburgh playing football, he was diagnosed, I believe, with leukemia, former leukemia. And I remember very well that saying he was going to have 12 chemo treatments. Well, I've had friends who unfortunately have had loved ones who needed chemotherapy, and they said they've seen these bills $10,000 or $15,000 or more for one chemo treatment is not out of the ordinary. So let's just take James Conner, for instance, and imagine he was on Medicare and had Medicare only, and each one of his treatments was about $15,000. So that would be $180,000 in chemotherapy. And I know he had that in less than a year's time. So with Medicare, your responsibility for that, it's a Part B service, would be 20% of $180,000 would be $3,600. Or excuse me, 36,000, not 3,600. That would be 2%. 20% of 180,000 would be $36,000. Well, with supplements and Advantage plans, you could never pay that much money. So, in my opinion, I've seen estimates where 10% of the population have Medicare only. That's crazy. You should not have Medicare only, in my opinion. You can get plans that cost zero that would limit that 36,000 to a fraction of that cost. So, the really 2 viable options again are supplements, we're going to talk about first, and then we're going to talk about Advantage plans. So supplements, again, I also said, are also known as Medigap policies. That is the perfect name for them. They are designed to cover the gaps in Medicare. It's that simple. So again, we went over the 5 gaps in Medicare in the last episode. I'll repeat them real quick. You got your hospitalization. There's 3 parts. There's the first 60 days. There's the sick days 61 through 90. There's days 91 through 100. There's days 21 through 100 in skilled nursing, and there's the 20% of Part B. Those are the 5 gaps in Medicare. Supplements are designed to cover those gaps, period. It's that simple. Again, hence the name Medigap, designed to cover the gaps in Medicare. They're secondary to Medicare. Again, when you go to a doctor or hospital, you'll show both cards or a lab, and there are almost no out-of-pocket costs after a small deductible of $198. So we sell Medigap policies labeled with letters A through N. There's only 11 choices. Those who got Medicare Part B or turned 65 prior to January 1st, 2020 have 11 choices. Those who turned 65 after January 1st of 2020 only have 9 choices. We recommend 2 plans, G and N. There are almost no out-of-pocket costs with those. One plan, again, you'll spend $198 out of your pocket, nothing else. And the other, you'll spend $198 and have 2 small copays of $20 or $50 and nothing else. Advantage plans, on the other hand, pay in place of Medicare. They are not secondary. When you take an Advantage plan, Medicare takes on a completely different role. Instead of your plan picking up what Medicare doesn't, what happens is the private company pays in place of Medicare. Medicare, instead of covering 80% of your bill and paying for your hospitalization, what they do is they pay a private insurance company of your choice to become your one and only insurance company. You can literally at that point put your Medicare card in a drawer because Medicare is done paying for any of your done paying claims. They basically have paid a company to get rid of you, so to speak. I hate to put it like that, but for lack of a better way to say it, I'm going to say it, they're paying to get rid of you. They're paying an insurance company to provide you with benefits and then pay all your claims, minus your copay. So you're going to have, the one big difference is you're going to have copays for all of those things that I just mentioned. So with supplements, once the deductible's been met, you don't pay for blood work, x-rays, CAT scans, MRIs, hospitalizations, surgeries, chemo, radiation, skilled nursing, diabetic supplies. With Advantage plans, you will pay copays for all of those things. So again, you might say, well, what the heck would anybody take an Advantage plan for when I have to pay for all those services, and with a supplement, I wouldn't have to pay for those services? Well, the answer is cost. And that is what differentiates, again, Advantage plans from supplements. So Advantage plans generally start lower, and you can literally get plans that cost $0 a month and come with Part D coverage. Again, how can they be $0? Remember, Medicare's paying a private insurance company $800 a month. They can make a profit off that, and that's one way they entice people to enroll in those plans is by offering low premiums. And again, that is a reason why you want to enroll in an Advantage plan, to save some money over supplements. Now, let me make this clear. You're going to hear this over and over again in this series. We won't recommend any plans, with maybe one or two exceptions in 2021, but with very, very little or no exceptions, we will not be recommending any Advantage plans that cost more than $50 for 2021, except in a very few instances. Okay, $50 is kind of that watermark. Supplements, on the other hand, start at $80 to $100 a month for a 65-year-old. Plus, those people have to buy Part D, standalone Part D plan prescription coverage, because unlike Advantage plans, they don't come with prescription coverage. So you're looking at between $98 to $118 for somebody 65 years old. Why the spread? Again, those prices are going to vary based on zip code, age, marital status, and whether you're male or female. I like to give this comparison, the front door, back door comparison, if you want an easy way to put this. Supplements, you're going to generally pay more at the front door, okay, in the form of premiums. If you get sick, you're not going to pay out the back door. Advantage plans, you pay less at the front door in form of premiums, but if you get sick, you're going to pay more out the back door, possibly thousands of dollars. That's kind of the give and take of those. Again, be careful on prices. We don't want anybody to pay over $50 a month, so just watch that, okay? Another difference is ancillary benefits provided by Advantage plans, not provided by supplements. What are ancillary benefits? We're talking about vision, dental, hearing aids, over-the-counter benefits, gym membership called Silver Sneakers, not provided by supplements in supplements in Medicare. They are provided with Advantage plans. They are very, very, very popular. Again, I want to warn people, these are not federally regulated for Advantage plans to provide. Not all of them provide them equally. If we're looking at Advantage plans and all things are equal, the maximum out of pocket is the same. The premium is the same. Copays are generally the same. Then we're going to start looking at, okay, who provides the better dental? Who provides more OTC benefits? That's where we come in. We can pinpoint those and find those plans for you that do that. So ancillary benefits, another difference. Access to doctors and hospitals. Supplements provide access to virtually every doctor in the country and every non-VA hospital in the country that accepts Medicare assignment. Again, every non-VA hospital in the country accepts Medicare assignment. I'd say 90% or more of doctors in the entire country accept Medicare assignment. There are very few who don't. I would not worry about that. I don't recall ever meeting anyone who called a specialist up and found that they didn't take Medicare. Medicare Advantage plans, on the other hand, have networks of doctors and hospitals that you must use. Some are smaller than others, some are bigger than others. HMOs, you must use participating doctors, facilities, and hospitals. You cannot go out of network for any care, with one exception, that's an emergency. PPOs allow you to leave the network. However, be careful with PPOs. You're going to hear me talk about this a lot. With PPOs, a doctor does not have to accept it except in an emergency. And when you leave the network on a PPO, you are going to pay more money for those services. So again, supplements, you don't have to worry about any battles between insurance companies and hospitals. You can go to UPMC, you can go to Allegheny Health Systems, you can go to Excella, you can go to independent hospitals, you can leave the state and go to places like Mayo Clinic, Cleveland Clinic, Johns Hopkins, and MD Anderson Cancer Center. I've had clients whose lives were saved at all of those places. With Advantage plans, we do have a couple of Advantage plans that Cleveland Clinic is a network, but we have no HMOs that have all of those other hospitals in network that I just mentioned. So that's a big difference between the two. Another difference is between plans is Medicare Advantage plans can change your benefits every year. From one year to the next, supplements cannot. We're going to see this. It's going to be a big deal in 2021. We're going to have 200,000 people who currently have Advantage plans now in 2020, that in 2021, their maximum out of pocket is going to be increased by as much as $4,000 or more. The maximum out-of-pocket represents what you can be billed in a calendar year. Some are as low as $3,400 now. They're going, some of those plans that are $3,400, $4,000, that's going up to $7,550 from one year to the next. That's a huge jump. Okay, we've seen this happen in other times with other instances. Supplements cannot do that. They're federally regulated so that when you buy your plan, whatever those copays are, whatever your out-of-pocket expenses are, that's the way it's going to be years from now. So, for example, people who buy Medicare Letter Plan G, they have one out-of-pocket cost. That's $198. Those people live to the year 2040, they're going to have one out-of-pocket cost. That's going to be that deductible. And once they pay their deductible, they're not going to pay for anything else. They can be assured of that. That's a big deal as well. Again, I don't want people to think, listen, some people think I'm anti-Advantage plan. I'm not. Please, I'm just pointing out the differences here. We have over 3,000 people enrolled in Advantage plans. There's a great place for them. There's still some great choices in Advantage plans, so don't think I'm anti-Advantage plan. Again, I want to remind everybody, we're brokers. We're appointed to provide plans from practically every competitive Part D supplement Advantage plan on the market. One more difference is how claims are paid and proved. This is something that's not talked about very often. Medicare Advantage plans can deny a claim or deny access to an outpatient surgery, to a CAT scan or MRI. You have to have prior approval for a lot of those services. They can dictate how many days you stay in a hospital or a skilled nursing facility. I want to point out that this does not happen nearly as much as it did 15, 20 years ago. In the early 90s, mid 90s, in early 2000s, I think justifiably so. Insurance companies got a bad reputation for doing that. They don't do that nearly as much. I want to tell you, it still happens. Just talked to a client a friend yesterday who's got a mother who was just denied into a skilled nursing facility that they wanted her to go in because the insurance company didn't feel that she was a good candidate for it. They did. She didn't. She went to a different facility that she wanted to go to. It does happen from time to time. Medicare does not employ people to make decisions on when you get the MRI, when you get a surgery, how long you can stay in the hospital. They let the doctors decide that. Your doctor in that hospital decides if you need to stay an extra day in the hospital. If the doctor thinks it's prudent for you to stay an extra day or two, you do. If the doctor thinks it's prudent for you to stay an extra day in a skilled nursing facility, you do. If the doctor wants you to go get an MRI immediately, hey, John, I want you to go to the third floor and get an MRI. I want to take a look at it. Go ahead and go now. With an Advantage plan, and I just had this happen to me recently because I had a torn meniscus. It's okay. We diagnose you with a torn meniscus. I'm pretty sure you have it. We're going to get you the MRI. We'll call you in a week or so when the approval comes back from the insurance company. If I was 65 on Medicare and had a supplement, I could have gotten that MRI right then and there, wouldn't have had to come back and worry about it not being denied. Had a friend who fought for over a year to get an MRI on her back, fought for over a year. She finally just got it done after appeal after appeal, after fight. Again, I want to defend companies because they do a much better job of this, but again, it still happens. And the last difference I want to talk about today is underwriting. So with Advantage plans, and this is a great thing about Advantage plans, there is no underwriting. Advantage plans must accept everyone into their plan regardless of health. Doesn't matter what the health conditions are. I can switch from one plan, one HMO and one PPO to the next every year during annual election period. No questions asked. I want to dispel that fear. There's going to be a lot of people that really, I believe, should switch from companies from one to another, or plans from one to another. I want to dispel the myth that there's pre-existing addition clause or one company might not pay something the other one does. That's not the case. You can go from one plan to the next. They must accept you regardless of your health. They must pay claims on day one that you start that policy. Don't worry about that. Supplements, on the other hand, if you want to go from one supplement plan to another, or more importantly, you want to go from an Advantage plan to a supplement, once you've been on Medicare Part B for a year, supplement companies can and do discriminate against people based on current or previous health conditions. They're going to ask a bunch of questions. Have you had a stroke or a heart attack in the last 2 to 5 years? Have you had cancer in the last 2 to 5 years? Do you have COPD? Do you have insulin-dependent diabetes? Do you have AFib? Those three I just named are automatic declines with practically every company on the market. And if you've been diagnosed with one of those things, if you have one, you can't get into a supplement. It is something that not a lot of people know. I'm trying to educate the masses on that. I've been preaching about that for years and years and years, but that is another difference between Advantage plans and supplements. So those are all the things you need to take into Advantage plan when deciding what option you want to choose, supplement or Advantage plan. That's all we've got on this topic for today. I am going to be signing out here shortly. We hope that you will subscribe to our YouTube channel where you can get notifications when new material pops up. We also go to our website and follow if you want to listen to podcasts on while you're traveling in your car. Don't forget about my columns in the Post-Gazette, page A2, called Ask the Medicare Specialist, A2, every Friday in the Post-Gazette, page A7 in the Trib. And this is Aaron Zolbrod, president and founder, signing out on our Medicare Reset Series. Be safe, everyone.